Hello friends, welcome back to my channel Breathwell Lung Care because every breath and every lung matters. Today I am back with one more very important sign which is called as bird nest sign. So in today's lecture I am going to discuss what is bird nest sign, how to identify the bird nest sign radiologically on CT scan, and what are the conditions in which bird nest sign is present with few examples of. So let us start with the today's lecture. So what is bird nest sign? So bird nest sign refers to the appearance created by the reverse halo sign with associated irregular and intersecting areas of the standing or the irregular lines within the area of the ground glass opacity. So both the bird nest sign and the reverse halo sign are suggestive of the invasive pulmonary fungal infections. For example, angio-invasive aspergillosis or mucormycosis in susceptible patient populations. So these fungal infections are commonly seen in the immunocompromised patients like patient with the diabetes, uncontrolled diabetes, or with the diabetic ketoacidosis and immunocompromised states like HIV positive patients. Though the bird nest sign is present most commonly in invasive aspergillosis or mucormycosis, it is not a specific for these infections only, but there are few other conditions also in which bird nest sign is present. So these conditions are cryptogenic organizing pneumonia, bacterial pneumonias, paracoccidioidomycosis, tuberculosis, sarcoidosis, venous granulomatosis, and pulmonary infection. We will discuss reverse halo sign in the next lecture. Then how will you differentiate between the mucormycosis and aspergillosis? Because this sign might be present in both the conditions. So it is important to distinguish between the mucormycosis and aspergillosis because the treatment can differ and oriconazole is not effective against the mucormycosis, and because of the appropriate early treatment, mucormycosis may have improvement in the outcome. So when we start early treatment, there might be a good outcome in the patient with the mucormycosis. So what are the few imaging features which favors the mucormycosis over the aspergillus? It is very important. So when the bird nest sign is present on the CT scan, when there are more than 10 pulmonary nodules present radiologically, presence of pleural effusion and concomitant sinusitis and development of the infection despite the oriconazole prophylaxis. As you all know, in the COVID-19 pandemic, there are incidences of the many rise in the cases of the mucormycosis in the second wave of the COVID-19 because of the uncontrolled diabetes as well as the overuse of the corticosteroid. Let us discuss with very important example. So this is an axial CT scan of a patient who is a known case of diabetes mellitus presented to the Department of Emergency Medicine with a diabetic ketoacidosis. He has fever, productive cough and dyspnea for 2 weeks. CT shows the bilateral patchy ground glass opacities, septal thickening and the subpleural band of opacities. In the superior segment of left lower lobe, the two cavitary lesions with the adjacent consolidation are seen and irregular and intersecting strands are noted with the cavitary lesions which along with the pericavitary consolidation gives an appearance of the bird nest. That's why it is called as the bird nest sign. So if you can see here, there are the patchy areas of consolidation which are present bilaterally, and on the left side in the superior segment of left lower lobe there is a cavity which is surrounded by the area of consolidation and the ground glass opacity, and that cavity has a irregular and intersecting strands which are noted there in the cavitary region. So this looks like a bird nest. That's why it is called as the bird nest sign. And when we perform the histological examination of the lung tissue of this patient, bronchoscopically we collect the sample from endobronchial growth or endobronchial infection, and the histopathological examination of the lung tissue revealed the presence of the mucormycosis. So this bird nest sign is because of the mucormycosis infection in this patient. Let us discuss with another example. This is an axial CT scan window of a 75-year-old female presented with the cough and the shortness of the breath since 2 weeks, which shows the large cavitary lesions with the surrounding consolidation and the ground glass opacities in the right lower lobe. And there are the irregular and intersecting strands which are seen within the cavitary lesions along with the pericavitary consolidation, which gives the bird nest sign. So it is also one more example with the multiple patchy areas of consolidation as well as the tree bird appearances or train bud nodules which are present here, and this cavity contains the irregular and intersecting strands which looks like a bird nest. That's why it is called as bird nest sign. And we again perform the histopathological examination of the lung tissue, which shows the presence of the invasive pulmonary aspergillosis. So this CT scan is a case of the invasive pulmonary aspergillosis, and this bird nest sign is because of the invasive pulmonary aspergillosis. So this is all about the bird nest sign. So I hope you all understand what is a bird nest sign, and it is very important to differentiate the diagnosis in which the bird nest sign is present, because this sign might be present in various other conditions, and it is very important to differentiate between the mucormycosis as well as the invasive pulmonary aspergillosis. So I hope you all understand what is the bird nest sign, and you will be able to identify the bird nest sign, and this will definitely helps in the diagnosis. So this is all about the today's lecture. Subscribe to my channel and share and like this video, and please press the bell icon so that you will get the notification of the further videos. So this is all about the today's lecture. Thank you so much.